Hi, my name is Tessa Donahue, and I'm a health educator in this area. I'm working on a new proposal to reduce the infant mortality rate in this state. So I'd like to talk to you a little bit about why this is an issue. So infant mortality in Louisiana is currently ranked second in the nation. 8.9 out of every 1,000 babies that are born are dying before their first birthday. This is well above the national average, which is currently 5.8 out of every 1,000 live births. So the infant mortality rate is defined as the death of a baby before his or her first birthday and is generally expressed out of every 1,000 live births. Louisiana also is currently ranked second in the United States for preterm birth. Preterm birth is defined as before 37 weeks gestation. Currently, 15% of the babies that are born in Louisiana are born before that mark, and the national average is 11.5. So we can see that we're also well above in both of these areas in comparison to the national average. Preterm birth is something that can negatively impact the development process and the health of a baby, and it can lead to a variety of complications linked to their vision, their hearing, their heart rate, blood health, immune systems, and breathing. Additionally, preterm birth has also been linked to autism and cerebral palsy and can lead to death, unfortunately. So Louisiana also currently leads the nation in the number of babies delivered cesarean, which is related to the infant mortality. Currently, 40% of the babies as of 2011 were born via that route. So almost half of the babies that are born are coming out via cesarean section. So something to look at. Just wanted to take a quick look at the infant mortality trends in Louisiana in comparison to the national trends. Overall, you can see that in the last 15 years, Louisiana has been quite a bit above the national average, and that the gap seems to be widening quite slightly in 2014. So there is some improvement to be made here at the state level and also nationally for the infant mortality rates that we're still experiencing. Just wanted to take a little bit of a deeper dive and look at some of the social determinants of health that influence this high rate of infant mortality in this region. So we know that socioeconomic status is a huge indicator of someone's health. Specifically, the concentrated poverty in this area is influencing the outcome of infant mortality. Additionally, access to healthcare services and insurance coverage. 2 points to pick out for this population specifically are those who need access to progesterone for mothers that have a history of risky pregnancies, and also the general access to prenatal care is a little bit more difficult for women in this region if they're underinsured or uninsured or low income. Healthiness of the mother. Overall, obviously, health of a mother is going to have a huge impact on the health of the pregnancy and the birth. So we know that specifically in this region, there are difficulties with tobacco use and also STI, sexually transmitted infections in this population. So looking to kind of help lower the rate of both of those in this population will be beneficial. Culture is also a difference here. We know that smoking is different in the South. We know that food is different in the South, that health in general has a different kind of look to it than it might on the West Coast or the East Coast, in areas where it might be more progressive than it is in the South. So overall, birth outcomes have historically been low in this region. Louisiana is currently ranked second for infant mortality and preterm birth. Infant mortality is a good measure that has long been used to rate the public health of a community or a region. This rate is currently unacceptable, and with the healthcare and technology that's available, it should be better. So we want to do better for the women and the future families of Louisiana. We would like to address this crisis through a multifaceted approach. Let's look at the social ecological model and kind of look at some of the key factors that influence infant mortality at each level. So we see at an individual level, a factor that can help infant mortality is economic status. Women with a stronger education background and access to higher paying jobs can have increased financial stability, which can impact a variety of things. With more money generally comes more ability to have good health care, access to higher quality foods. There's a variety of things that are linked to that. One thing that can hinder at this level is age. We know that women that are younger or older, while pregnant, can have additional risks associated with the pregnancy and the birth. So trying to kind of target the people at either end of the spectrum when talking about infant mortality. Interpersonal level, strong family support is obviously something that's positive across the board when it comes to health, but it also is strongly linked to birth outcomes. So women that have family, friends, and community members that can kind of lift them up, support them, and be there for them often have healthier pregnancies and births. One factor at this level that can hinder is, experience of domestic violence. A woman who is a victim to partner abuse or violence is going to be more likely to have an infant that is more likely to pass away or have health issues, especially if this is happening while the woman is pregnant. Looking at the organizational level, one factor that helps is access to health care. Like I said before, specifically prenatal care can improve birth outcomes and reduce infant death. The women that obtain prenatal care have, an ability to kind of look at the pregnancy and the birth throughout all of the stages of development. So things like smoking and STIs can be addressed at the prenatal care appointments. Additionally, mothers that live in poverty are at higher risk of infant mortality. They often have less access to things like transportation, fresh food, clean air, which can hinder their health and the baby's health. At a community level, we see that access to quality community programming is a huge positive benefit for women and babies. Things like a community doula program can give additional support to women and can also be an affordable way for mothers to go into the birth process. We know that research shows that the support of a doula can reduce preterm birth and C-section rates, which are both associated with infant mortality risk. One factor that can hinder at this level is the built environment. If the built environment lacks affordable transportation options, this can hinder a mother's ability to get to doctor's appointments, get to the grocery store, and just get from point A to point B. It could be getting to their baby's first well checkup, a variety of things. And finally, at the policy level, we see that funding can be a huge benefit. If we are supporting maternal and child health care services, we're going to see an improvement in birth outcomes. When you put money towards things like prenatal care or access to care for women who might not have it, you're going to see a positive boost there. Something that can hinder at this level is the lack of policy that supports quality and secure housing for women. Women who experience homelessness or cannot secure quality housing for themselves and their babies or their families have higher levels of stress, which can negatively impact pregnancy and put them at higher risk for poor outcomes for their birth. So my proposal is the Happy Mother and Baby Van. It's a mobile van that can travel the state of Louisiana to serve as many women as possible. With this van, we'd like to provide women with support, education, treatment, and resources to have happy, healthy babies and a positive birth process. The van would be scheduled in rural and urban communities with a community partner to bring a day of pregnancy and reproductive health-related services to the people. Each day would include childbirth education classes, STI education, testing and treatment, and a smoking cessation counselor that would be available with some resources. The van would be staffed with a childbirth educator, a public health nurse, and a smoking cessation counselor, as well as the driver. Services would be provided to individuals on a sliding scale basis with insurance coverage used where applicable. The first intervention would be an education and pledge campaign aimed at both the physicians that are delivering the babies and the mothers to hopefully reduce the early induction rate and early elective cesarean deliveries that happen before 39 weeks gestation. We know that those are both linked to higher infant mortality, so educating physicians on what best practice is for birth and also asking them to pledge to reduce the number of elective early inductions and elective cesarean deliveries that they're having at their hospital. Also working with the women to educate them on the benefits of full-term birth and how kind of allowing the process to happen naturally and not electively is going to be a benefit to them and their baby. The second intervention would tackle the smoking cessation program. Quitting smoking is obviously a challenge for any individual, but it's increasingly difficult when a person is pregnant. This impacts not only the mother but the baby, and there has to be a little bit more taken into the approach to kind of help them step away from that. The Southern culture obviously is a little bit different in terms of smoking. We see higher rates there in general, so it's definitely something that is a little bit more complicated. So we would like to offer coaching, education materials, and free or reduced cost nicotine replacement products to these women. Lastly, we would like to offer STI education and screening for women. We know that sexually transmitted infections can complicate a pregnancy and negatively impact the mother and the baby. We still are seeing high rates of STIs in this region, especially within the population of pregnant women. So there's a need to educate, screen, and treat these people. So we would like the nurse to be available for education on the common symptoms, the prevention methods, and impacts that it can have, and offer screening and treatment for those who are opting into that. Our data collection methods look like this. So we're going to have medical record review as well as a survey. The medical record review would be aimed at past records and future records to gain a big pot, I guess, of data that kind of looks at the rates of different types of deliveries and also the prevalence of STIs during pregnancy. So we would be looking at 10 major hospitals in the area, those that are mostly serving Medicaid population that are seeing high rates of deliveries, because we know that not all hospitals are going to be doing a lot of deliveries all the time. The survey would be used to collect information on all 3 interventions, pre and post-intervention, and the questions would be aimed at the following. We would be looking at collecting information on demographics, birth and pregnancy history, understanding of delivery and birth experiences and best practices, wants for their current or near future delivery method, understanding of importance of full-term birth, current nutrition, exercise, sleep, and stress levels, current smoking status, and frequency and past quit attempts, as well as history of STIs and STI testing. We would also include information about satisfaction with the class and the screening experience. Our proposed evaluation would be looking at some short-term and long-term outcomes. Obviously, the short-term outcomes of the program would be that we have established a community childbirth education program. We've developed a pledge program, and we've decreased rates of STIs and smoking. Our long-term outcomes would be community partnerships that are established, increasing number of physicians participating in the pledge, a change in attitudes surrounding the birth process, and increased number of women with access to education and care. The measures that we're specifically looking at that will allow us to know if we've been successful or not are aimed at the 3 interventions. So reducing the preterm birth rate from 15 to 10% or less for the state, the reduction of STIs across all infection categories for women in general in the state, and also reduce the rate of women ages 18 to 44 who smoke in the state of Louisiana from 25 to 20% for smoking cessation and education. The overall impact that we're looking to have is to reduce the infant mortality rate in Louisiana. Some challenges and barriers that we might face are that women may not be open to screening and treatment for STIs due to the personal nature and stigma associated with STIs, and this could be approached by including pamphlets and education for women who may not want to talk about it on the spot, and also referral to testing sites if they want to do it at a later date. Additionally, the project will require a good amount of funding, which could be difficult to secure and maintain year after year. So working to secure funding from multiple sources and incorporate insurance billing would be a potential solution. I'll just review one more of these. Physicians and mothers may be resistant to change in how and when delivery should happen, so collaborating with physicians that are already practicing this way to kind of bring those physicians up to speed and kind of talk to them about how they make that a part of their practice. So let's move on to the logic model. We see a variety of the inputs, activities, and outcomes that we've already discussed today, but just some overview. The staff would include a director, assistant director, assistant researcher, the educator, the nurse, like I already mentioned, and some volunteers. Some community partners that we'd be looking to build relationships with are local hospitals, birthing centers, the local cessation line, and the Department of Health. And some of the funding we're looking to secure is March of Dimes, the Health and Human Services Healthy Start grants, and private foundation grants and donations. We see a variety of activities are going to be happening within the 3 interventions that we've proposed. We have also seen that there's going to be a variety of positive short-term and long-term outcomes that come as a result of this program. And again, our impact, we're looking to reduce the infant mortality rate in Louisiana through traveling the state and giving women access to high-quality reproductive care that they need to kind of have a happy, healthy birth process and a happy, healthy baby at the end of all of this. So I hope you'll join me in this effort and support our proposal for this van. I look forward to speaking to you more about this in the future. Thanks.